Miss Audrey Nath, is that correct? I'm sorry if I butchered your name here. I'm not sure.
Hi, I am Audrey Nath, N-A-T-H.
Okay, thank you.
It's all right. I'm a neurologist and epileptologist, and I practice in the state of Texas. So what brings me here today is when I first heard about the death of Anthony Simmons, who died of a seizure in Harris County Jail. And since then, I've become aware of other cases of people needlessly dying from seizures. Just very briefly, people shouldn't be dying from seizures. We're not talking about some really fancy medical care here. This is pretty basic. It's unacceptable. So I started looking into this. I'm hearing one report on the news. I'm hearing from other families, like, how often are people dying from seizures? The scientist in me wants to know, what is the scope of the problem? So I'm trying to look like, all right, what are the yearly deaths from seizures in county jails? And I can't find numbers. I've looked on the Texas Jail Commission website, and I'm not finding definitive numbers. And I also worry that some seizure deaths may be categorized as other things. For example, when patients withdraw from some types of medications and drugs, such as withdrawal from benzodiazepines, that can cause seizure activity, which is just as deadly as any other seizure activity, which can result in death. But given the role of the benzodiazepine drug, it's possible that that death could be categorized as some sort of drug-related death. So it may be hard to know how many of these deaths are actually happening. So I looked further to see, okay, what is the seizure protocol in the jails? In medicine, in the hospitals, we talk about seizures, and we also talk about prolonged seizures, which we refer to as status epilepticus. It's just the fancy way of saying a seizure that goes beyond 5 minutes, which can be fatal. So I looked, and I couldn't find a protocol for how the jails handle prolonged seizures or status epilepticus, and I have submitted a records request to find if there is a seizure protocol. And in the absence of that, I just went ahead and wrote up a quick seizure protocol based on consensus guidelines from the American Epilepsy Society that I'll be distributing to all of you, because we should be able to treat seizures. We really shouldn't have more people dying of seizures in our jail. A death from seizure is a preventable death. Thank you.
Thank you, Doctor. Thank you.